Hi everyone. Today in this video we are going to discuss about Ibandronate. What is this drug Ibandronate? The suffix dronate indicates that this drug is a bisphosphonate. And this drug contains nitrogen as amine. So Ibandronate is an amine containing bisphosphonate. This drug is particularly indicated for the treatment of osteoporosis in postmenopausal women. As this drug is going to reduce the bone resorption, Ibandronate increase the bone mineral density in postmenopausal women. This Ibandronate can be given either daily or it can be given monthly in order to reduce the osteoporosis. So in this video we are going to discuss how this drug acts, what are the important precautions, how this drug should be taken, what are the conditions that should be maintained during the intake of Ibandronate, what are the important side effects. All these things we will discuss in this video. So this is the structure of Ibandronate. Here this entire group indicates this drug is having bisphosphonate moiety. And here we can also observe the nitrogen which is present as amine. So Ibandronate is a amine containing bisphosphonate. Now let us see how this drug acts. The bone resorption is mainly mediated by osteoclast activity. These osteoclasts can bind to the bone matrix where they increase the acidification and resorption of the bone. But from the systemic circulation, Ibandronate can bind to the bone matrix, and because of high affinity, Ibandronate can be taken into the osteoclast by endocytosis. Now once it is going to be accumulated within the osteoclast, it can inhibit one of the important enzyme which is responsible for binding of osteoclast to the bone matrix. This enzyme is nothing but FPP synthase, farnesyl pyrophosphate synthase. This enzyme is going to convert the farnesyl pyrophosphate into GGPP, geranyl pyrophosphate. Now Ibandronate can bind to this enzyme, thereby this drug inhibits the activity of this enzyme. Now when this enzyme is not working properly, isoprenyl units are not going to be increased, which reduce the isoprenylation and protein synthesis. When the proteins are not synthesized within the osteoclast, they cannot bind firmly to the bone matrix, so there will be a gap between the bone matrix and the osteoclast. Finally, due to loss of these proteins, now osteoclasts can be removed from the bone matrix and they can undergo apoptosis. In this way, Ibandronate can reduce the osteoclast activity, thereby can reduce the bone resorption. What are the precautions of Ibandronate? Just like other biphosphonates, Ibandronate can produce upper GI tract side effects. It can produce upper GI mucosal irritation, leading to one of the condition, Barrett's esophagus. This results in the narrowing of esophagus along with some perforation and bleeding, and it can also produce esophageal ulcers. Similarly, it can reduce the swallowing resulting in dysphagia. Even it can increase the inflammation resulting in gastritis. Similarly, it can increase the ulceration, perforation of the mucosa. Even gastrointestinal bleeding can also be observed with this Ibandronate, particularly at high dose. In order to eliminate these upper GI adverse effects, this drug should not be taken in the lying position. In the upright position only, this drug should be taken in order to avoid GI reflux and GI irritation. Second important precaution is that this drug can reduce the calcium levels within the serum, resulting in hypocalcemia. So that's why patients should take calcium supplements, and they can also take vitamin D supplements in order to reduce hypocalcemia as well as to increase the bone strength. But these calcium supplements and vitamin D supplements should not be combined with Ibandronate, because it reduces the absorption of this drug. So along with Ibandronate, any minerals or vitamins should not be given. At least 60 minutes gap should be maintained between the intake of Ibandronate and any other mineral supplements. Similarly, this drug can increase the musculoskeletal pain resulting in myalgia, back pain. So again, when severe back pain is observed, this drug should be carefully used. Another important effect is observed on the tooth as well as jaw. This drug can produce the necrosis of the jaw, leading to decreased strength. So whenever any jaw necrosis is observed, care should be taken, and it may be avoided in severe conditions of jaw necrosis. Similarly, this drug can produce femoral fractures. So without any significant trauma, femoral fractures can be observed with long-term use of ibandronate. What are the side effects? The important side effects are related with the GIT. It can produce some dyspepsia. It can also produce some muscle disorders resulting in back pain. Central side effects like dizziness, headache, vertigo. It can also produce myalgia, muscle pain, gastritis, diarrhea, and inflammatory disorders like bronchitis, bronchial inflammation, arthritis, inflammation at the joints. It can also produce asthenia, lack of energy. Tooth disorders can be observed with this ibandronate. How it is given? This drug is available as tablet. It is also available as injection. As a tablet, it is available at a strength of 150 mg. And this drug is also available as 2.5 mg tablet. At a low dose of 2.5 mg, this drug is given daily for the treatment of osteoporosis. But this 150 mg tablet is given for each month. Even this drug is also available as IV solution. But here we are going to discuss the 150 mg tablet which is given for every month to treat osteoporosis. Now at a dose of 150 mg, ibandronate is given as one tablet at every month. On each month it should be taken at the same time so that it can produce better therapeutic effect. And this drug should be taken on empty stomach. So at least 60 minutes gap should be there before any intake of food during the early morning. So without any intake of liquids or solid food, this drug should be taken. This tablet should not be chewed. It should be swallowed with plain water only. For taking this tablet, the mineral water should not be used as it reduces absorption of ibandronate. And this drug should not be combined with any mineral supplements such as calcium or any vitamin D supplements, antacids. With all these components, ibandronate should not be combined. Even after intake, within 60 minutes, food should not be taken. So any liquids and food should not be administered within 60 minutes after administration of this drug. Only plain water can be taken within 60 minutes. And again, this drug should not be taken on lying position as it increases upper GI irritation. So that's about this drug ibandronate, which is indicated for the treatment of osteoporosis in the postmenopausal women. And this drug is going to reduce the bone resorption by inhibiting the osteoclast function, and it increases apoptosis of osteoclast, resulting in the decreased bone resorption. Upper GI mucosal irritation, esophageal ulcers, gastric ulceration, perforation are the important precautions that should be considered with ibandronate. This drug can also produce hypocalcemia, which should be closely monitored. So that's about this drug ibandronate, which is a nitrogen containing bisphosphonate. So that's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.